G'day folks, Dr. Liam Cartwright here. Look, I've been practicing medicine for over 3 decades now, and what I'm about to tell you today might completely change how you think about something that's been around since, well, forever. Yeah, I'm talking about masturbation, and before you click away thinking this is some dodgy content, mate, hear me out because this is purely about your health and well-being. I've treated thousands of blokes over the years, and I can tell you straight up that this topic doesn't get discussed nearly enough in medical circles, especially when it comes to us older fellas. The science behind what I'm sharing today is absolutely fair dinkum, backed by proper research from universities and medical institutions around the world. This isn't some trendy wellness rubbish. This is legitimate medical information that could genuinely improve your quality of life as you age. Now, I know some of you might be thinking about religious or cultural perspectives on this topic, and I respect that completely. I'm not here to tell anyone what's right or wrong for them personally. What I am here to do is present you with the medical facts, the real health benefits that have been documented in scientific studies, and let you make your own informed decisions. At the end of the day, it's your body and your health we're talking about. Before we dive in, let me make something crystal clear from the start. When I talk about masturbation being beneficial for your health, I'm talking about the act itself, not watching pornography. These are two completely different things, and I'll explain why later. But the health benefits I'm discussing today can be achieved without ever looking at a screen, all right? Right, let's get into it. I'm going to walk you through 8 significant health benefits that masturbation can provide for men as we get older. And I'll tell you straight up, I'll be referencing proper research throughout, including studies from Harvard Medical School, the Mayo Clinic, and peer-reviewed medical journals. If you want to check any of these studies yourself, I'll have links in the description below because I reckon it's important you can verify this information for yourselves. First up, and this is a big one for us older blokes, improved blood circulation. Now, as we age, especially if we're spending a fair bit of time sitting around, our circulation naturally starts to decline. This affects everything, but particularly the blood flow to our extremities, and yes, that includes down below. Regular masturbation actively promotes blood flow to the genital area and throughout the body. For us men, this is absolutely crucial for maintaining erectile function and preventing problems down the track. There's a study published in the American Journal of Medicine that followed older men over several years. What they found was that regular sexual activity, including masturbation, was directly linked with a reduced risk of erectile dysfunction. Think about it this way. Your cardiovascular system is like the plumbing in an old Queenslander house. If you don't run the water through the pipes regularly, they're going to seize up. Same principle applies here, mate. I had a patient, let's call him Bill, who came to see me at 68, complaining about erectile difficulties. After ruling out other medical issues, we had a frank discussion about his sexual activity. Turns out he'd basically stopped all sexual activity after his wife passed away 3 years earlier. Within a few months of resuming regular masturbation, along with some other lifestyle changes, his erectile function improved significantly. He told me it also helped with his mood and gave him something to look forward to in the mornings. Which brings me to my next point, the release of feel-good hormones. When you masturbate and achieve orgasm, your body releases a cocktail of beneficial hormones, including endorphins and dopamine. These are your body's natural mood elevators, the same chemicals that make you feel good after a decent walk or a good laugh with your mates. For us older blokes, particularly those dealing with stress, anxiety, or even mild depression, this natural hormone boost can be genuinely therapeutic. A study published in Biological Psychology showed that orgasm significantly increases dopamine levels in the brain. This isn't just about feeling good in the moment. It actually helps reduce symptoms of depression and improves overall mental well-being. And let's be honest, as we get older, we face more challenges, losing mates, health issues, retirement adjustments. Having a natural, free way to boost your mood isn't something to sneeze at. Now, hands up if you struggle with sleep. Yeah, thought so. Better sleep quality is the third major benefit I want to discuss. As we age, getting a good night's sleep becomes increasingly difficult. Your body's natural sleep patterns change. You might be waking up more frequently or struggling to fall asleep in the first place. Well, here's where masturbation can help, and the science backs this up completely. When you orgasm, your body releases prolactin, a hormone that promotes relaxation and sleepiness. The Mayo Clinic conducted research showing that this prolactin release can induce a state of deep relaxation, making it significantly easier to fall asleep. I've had countless patients tell me that having a bit of solo time before bed has helped them sleep better than any sleeping tablet ever did, and without the side effects. One bloke told me, "Doc, it's better than a Valium and doesn't leave me feeling like a zombie the next morning." Here's a practical tip from my years of clinical experience. If you're struggling with sleep, try masturbating about 30 to 60 minutes before you want to fall asleep. Don't do it right in bed. If you're having trouble associating your bed with sleep, maybe in the shower or bathroom, then head to bed once you're feeling relaxed. Works a treat for many of my patients. All right, now we're getting to something specifically important for us blokes: prostate health. This is probably one of the most significant findings in recent medical research, and it's something every man over 50 should know about. Regular ejaculation, including through masturbation, appears to help maintain prostate health and may reduce the risk of prostate cancer. The Harvard Medical School conducted a massive study following over 30,000 men across several decades. What they discovered was genuinely remarkable. Men who ejaculated more frequently, including through masturbation, had a significantly lower risk of developing prostate cancer compared to men who ejaculated less frequently. The theory is that regular ejaculation helps flush out toxins and potentially carcinogenic substances that can accumulate in the prostate over time. It keeps the whole male reproductive system healthy and functioning properly. Now, let's talk frequency for a minute, because I know you're probably wondering what regular means. Based on the research, we're looking at around 21 times per month, showing the most benefit. That's roughly 5 times a week, give or take. But look, don't stress if you're not hitting that number. Some is better than none, and quality matters too. Listen to your body, there's no one-size-fits-all approach here. The 5th benefit is strengthening your immune system. Yeah, you heard that right. Regular sexual activity, including masturbation, actually gives your immune system a boost. A study published in the journal Neuroimmunomodulation found that sexual activity increases the number of white blood cells in your body. These are your immune system soldiers, the cells that fight off infections and keep you healthy. Additionally, orgasm temporarily reduces cortisol levels. Cortisol is your stress hormone, and chronically high cortisol can actually suppress your immune system. So by reducing cortisol through regular orgasms, you're giving your immune system a better chance to do its job. In my practice, I've noticed that patients who maintain regular sexual activity, whether with a partner or solo, tend to report fewer colds and infections. Obviously, this is anecdotal, but the science supports it. Number 6, maintaining your libido and sexual function. This is a use it or lose it situation, fellas. Regular masturbation helps keep your sexual organs stimulated and maintains your sex drive, which can naturally decline as testosterone levels drop with age. The Journal of Sex Research published findings showing that regular masturbation helps men maintain their erectile capacity and prevents the loss of sexual sensitivity that can occur with age. I've had blokes in their 70 seconds and even 80 seconds come to me saying they've given up on sex altogether. But here's the thing, if you stop all sexual activity completely, your body basically decides you don't need that function anymore. The blood vessels can atrophy, sensitivity decreases, and getting back to any kind of sexual function becomes increasingly difficult. But if you maintain some level of regular sexual activity, even if it's just masturbation, you're much more likely to maintain the capacity for sexual function should you want it in the future. Let me tell you about another patient. We'll call him Frank. He came to see me at 73, had been single for about 5 years after his divorce. He'd basically stopped all sexual activity and was experiencing significant erectile dysfunction. We worked on getting him back into a routine of masturbation a few times a week. Within about 3 months, his function improved noticeably. Then he met someone, and he was actually able to have a sexual relationship with her. He told me later, "Doc, if I'd known this, I wouldn't have let things go so long." The 7th benefit is natural pain relief. The endorphins released during orgasm are natural painkillers. They're actually more powerful than many people realize. If you're dealing with chronic pain, arthritis, back pain, the kind of aches and pains that become more common as we age, masturbation can provide genuine relief without needing to reach for the painkillers. The Journal of Pain published research showing that masturbation can significantly reduce pain perception. This is partly because the endorphins block pain signals, but also because the neurochemicals released during orgasm help your body relax, reducing muscle tension that often contributes to chronic pain. I've had patients with arthritis tell me that having an orgasm in the morning helps them move more easily throughout the day. It's not going to replace your prescribed pain management, but it can certainly complement it. And finally, number 8. Stress and anxiety reduction. Blokes, we're not always great at dealing with stress. We tend to bottle things up, tough it out, and that can take a real toll on our mental and physical health. Masturbation provides a natural, healthy outlet for stress relief. The combination of physical release, hormone production, and that moment of pure focus on physical sensation can provide a significant mental break from whatever's worrying you. In my 3 decades of practice, I've seen how stress affects health outcomes. High stress levels contribute to everything, from heart disease to depression. Any tool we have to manage stress naturally is worth using, and masturbation is one of the simplest, most accessible stress management tools available. Now, I want to address the frequency question properly because I know it's on everyone's mind. Based on the research, particularly the Harvard prostate cancer study, around 21 times per month, or roughly 5 times a week, seems to provide optimal health benefits. But here's the important bit. This isn't a prescription or a requirement. If you're doing it twice a week, that's still beneficial. If you're doing it daily, that's fine too, as long as it's not interfering with your daily life or relationships. What's not healthy is doing it compulsively, multiple times a day, to the point where it's affecting your work, your relationships, or your responsibilities. That's when we're moving into problematic territory. But for most blokes, anywhere from a few times a week to once a day falls well within the healthy range. Right, now I need to talk about something important, the difference between masturbation and pornography. Look, I'm not here to be a wowzer or tell you what you should or shouldn't watch. But as your doctor, I need to explain the medical perspective on this because it's genuinely important for your health. The health benefits I've discussed today come from the physical act of masturbation and the resulting orgasm. You don't need pornography to achieve any of these benefits. In fact, excessive pornography use can actually create problems, particularly as we get older. Here's why. Pornography triggers massive dopamine releases in your brain. Now, dopamine is good in the right amounts, but too much, too often, and your brain starts to become desensitized. You need more and more stimulation to get the same effect. This is similar to how addiction works with drugs or alcohol. Research published in the Journal of Behavioral Psychiatry shows that excessive pornography use can actually change your brain's structure and function, leading to problems with memory, concentration, and impulse control. For older blokes, this is particularly concerning because our brains are already experiencing age-related changes. Adding the effects of pornography addiction on top of that can accelerate cognitive decline. I've seen patients in their 60 seconds and 70 seconds who've developed significant erectile dysfunction specifically because they've become so dependent on pornography that they can't achieve arousal or erection without it. A study from the International Society of Sexual Medicine found that men who regularly consume pornography are more likely to experience erectile dysfunction and lose interest in sexual relationships with actual partners. The problem is that pornography creates unrealistic expectations about sex that can't be met in real life, leading to disappointment and frustration. Now, I'm not saying that occasionally looking at some adult content is going to ruin your life. What I'm saying is that if you can achieve the health benefits of masturbation without relying on pornography, that's the healthier approach. Use your imagination, your memories, whatever works for you. If you do occasionally use pornography, keep it moderate and be honest with yourself about whether it's becoming a habit or a dependency. The bottom line is this: masturbation is a natural, healthy part of human sexuality, and the scientific evidence clearly shows it has genuine health benefits for older men. It's not something to be ashamed of or guilty about. It's not immature or inappropriate. It's a legitimate form of self-care that can improve your circulation, boost your mood, help you sleep better, maintain your prostate health, strengthen your immune system, preserve your sexual function, relieve pain, and reduce stress. In my 30-plus years as a doctor, I've learned that the patients who do best as they age are the ones who take a holistic approach to their health. They eat reasonably well, they stay as active as they can, they maintain social connections, and yes, they maintain a healthy sexual life, whether that's with a partner or solo. I hope this information has been helpful and maybe even opened your eyes to something you hadn't considered before. Remember, all the studies I've mentioned are linked in the description below if you want to have a look for yourselves. I'm a firm believer in evidence-based medicine, and everything I've shared today is backed by proper scientific research. If you have questions or concerns about your sexual health, please talk to your GP. Don't suffer in silence because you're embarrassed. Trust me, Your doctor has heard it all before, and having these conversations is literally part of our job. Sexual health is health, full stop. Take care of yourselves, fellas. Until next time, this is Dr. Liam Cartwright reminding you that looking after your health includes all aspects of your well-being, even the ones we don't always talk about at the pub. Cheers.